morning, everyone. Good day, and welcome to the Thematic Innovation Ecosystem on Digital Health and Data. This event, this gathering, is co-hosted by ECH Alliance and Hellenic Digital Health Cluster, and it's organized within the framework of the Digital Health Uptake Project. Digital Health Uptake Project is a project financed by the European Union within the Digital Europe program, and its aim is to boost the uptake of digital health solutions in the regions, in the countries of the European Union. And today we will explore how this can be done by using the approach of the collaborative clusters, how those clusters can support the SMEs in getting the connections, getting the small and medium enterprises in getting the connections and getting access to the market, and how we can collaborate together to make sure that better digital health solutions are being created, are being financed, are being adopted and scaled up. My name is Karolina Mackiewicz. I work at the ECH Alliance, the Global Health Connector, and that is one of the co-hosts of this webinar and the partner of Digital Health Uptake Project. And I will just here give a very short introduction to the concept of the cross-sectoral, multi-sectoral ecosystem that will be a bit of base for this discussion. And then I will pass to my colleague George Dimitriou from the Hellenic Digital Health Cluster to take over this webinar to give a bit more introduction about the work of the his work at the Digital Health Cluster, and then also introduce the speakers and moderate the discussion. You can connect with us through the chat. You can ask the questions. And yeah, let's go on with a very short intro to the concept of the ecosystems and why it's important to work across sectors to break those silos for better digital health and uptake of digital solutions. ECH Alliance, as the Global Health Connector, is the organization that connects the stakeholders. This is in our DNA. This is in the core of our operations. We exist to connect, convene, to amplify and accelerate changes in digital health market, the digital health ecosystem. And here you see our 4 core teams, which are sustainable health, green health, healthy aging, women's health, and health data. And today's meeting applies to this health data. And of course, it's relevant to all the teams. As I said, we are the organization that exists to connect, and we are the membership organization that brings together over 1,000 members from different sectors, organizational members, and also brings together more than 80 digital health ecosystems from around the globe together so that they can learn from each other and they can connect. And today, going from this big picture, from this global picture, we will a bit zoom in to how those clusters, how those ecosystems, how those partnerships can work on the regional level or cross-country level to deliver better digital health solutions. We also have a network of the thematic innovation ecosystems, meaning the ecosystems that meet online, like this one, to work on a specific theme. And on this graph that I think, on this visual that I think many of you might know very well already, we show what is the idea of those ecosystems. So really bring all the sectors and subsectors together. So if we speak, for example, about policymakers, we encourage the ecosystems to engage not only with the governments, but also with the local authorities, not only with the big companies, also with the startups, and so on. This is the list of our digital health ecosystems that belong to our network. And here we can see our thematic innovation ecosystems. And with this, I will stop here but just saying that also the why health data is important for ECH Alliance. We are the organization that also has the health data arm, which is called Digital Health Society. Again, some of you might know it. And Digital Health Society is the part of ECH Alliance that works on the thought leadership on health data, hosting, for example, the series of the cross-sectoral roundtables. And for example, it has published the calls to action on health data ecosystems. And also we host the Digital Health Society Summit, a two-day virtual free for all event dedicated to the topic of health data and data and digital on 5th and 6th of November. We will post the link to the event in the chat. You can register, you can join, check the program and join us for free. And with this, I will stop here and I will invite George Dimitriou from the Hellenic Digital Health Cluster to take over and go on with the webinar and also introduce our speakers and introduce the our meeting further. Thank you so much.
Thanks a lot, Carolina, for giving us this opportunity, and thanks to ECH Alliance and the Digital Health Uptake project that made this event possible. And we have this great opportunity to discuss with other clusters what we are doing. Of course, we have all the same goal to support SMEs and mostly the digitalization of SMEs. So today we have three clusters here today. We have and three participating countries. We have the iVita cluster from Lithuania. Diana is here with us, and we have the DHI cluster from Bulgaria. We have Mira with us, and I'm George Dimitriou. I'm the cluster manager of the Hellenic Digital Health Cluster in Greece. So my presentation has a first part where I'm describing how we set up our cluster. Then I will share some practical examples of how we have supported SMEs. And finally, I will explain how we see the added value of collaborating networks. So having said that, our cluster, the Hellenic Digital Health cluster aims to empower the Greek digital health ecosystem and make it competitive in the European and in the global scene. So we focus on areas such as health IT, data management, telehealth, wearable, personalized and digital therapeutics, and AI and advanced analytics. I have to say that HDHC is an initiative of FORT. FORT stands for Foundation for Research and Technology, is one of the biggest research centers in Greece, and specifically two subunits of FORT, the Center of E-Health Applications and Praxis Network, were the founding units that set up the cluster. So what we did first, FORT identified the need. What is the need? The need is to advance healthcare digitalization, support SMEs and startups, and foster collaboration across sectors to drive innovation. So what we did, we brought together key stakeholders, such as research institutes, healthcare providers, and technology companies, and innovation accelerators. So we try to bring stakeholders from the so-called quadruple helix to accelerate the development and adoption of digital health solutions. After identifying the need and attracting stakeholders, we had some initial funding from the Ministry of Development in Greece to set up the cluster. And we set up the cluster organization as an autonomous legal entity. We established membership fees. And from then, we always expand our network through different collaborations and synergies, and we expand the member list, our member list. We also participate in different EU funded projects, and now we have a place to to think more broadly in European terms how we can collaborate with organizations, other clusters, or other initiatives that with whom we have the same focus. There are some challenges doing that. Each country, regarding the cluster policy, has its own peculiarities and characteristics. In Greece, there aren't so many successful clusters, and that has several reasons. The most significant one is that there isn't continuous support, and clusters usually don't manage to become sustainable. So they run for a couple of years, and after that, they are not sustainable to keep a level of operations going. So in Greece, we are in a worse situation, but we see as HDHC other best practices and try to create we are doing efforts to support to persuade our government and our authorities to better support clusters. What are the benefits for SMEs? What are the benefits for SMEs to become members and participate in such networks? The first one is the access to funding and investment. For example, through our cluster, and I will share that later on, we have supported SMEs to attract either EU or national funding and investment. Another benefit is collaborative opportunities. For example, there are members in our cluster that they have met in our cluster, and either they had a collaboration or they did a proposal to attract funding. Through the cluster, an SME can get access to expertise and resources, increase visibility and market access, networking and internationalization, and training opportunities. An example would be for a project that we now participate. It's called Veles. It's an excellent hub focusing on building a regional health data space. Now, what an SME can get out of Veles? For example, we have SMEs that are getting access to cutting-edge research and innovation. They have the opportunity for cross-regional collaboration, and they perform pilots for specific conditions in each of the countries that they participate. So it's an excellent opportunity for SMEs for testing new tools and for capacity building. Another project that we participate, it's called Level Up. There we gave the opportunity to SMEs to highlight specific training needs, and then we collaborate with training providers to develop relevant training courses that are offered now for free and cover specific needs in digital health. Having said that, we're building a collaboration with other organizations like ours. Here today is IVITA and DHI, but we have also collaborations all around Europe with cluster, with innovation organization. We participate in different networks like the ACH Alliance that hosts us here today, and other networks and projects. And we support European digital innovation hubs. In Greece, there are two hubs that focus in health. The one is called Smart Health, coordinated by Forth, and the other one is Health Hub, coordinated by IED. So what's the we're speaking now about collaboration among networks, and the Digital Transformation Accelerator is the authority that oversees the European Digital Innovation Hub, has published some strategic guidelines on how to collaborate among networks. And the three main tools that the European Union uses to support the digitalization of SMEs is the European Digital Innovation Hub, the EDIX, is the Enterprise Europe Network, and the industrial cluster. So in these guidelines, there are specific examples and cases on and best practices on how these networks and tools can collaborate to better support companies. In our case, we have the example that here at Forth, we support Forth supports different clusters. Of course, HDHC, but three other clusters have also been founded in the past. Forth also coordinates the European Digital Innovation Hub, the Smart Health, and also is the coordinator for Enterprise Europe Network LR. So under one research center with different initiatives, different legs, we managed to collaborate to better support SMEs. And we have some tangible outcomes out of that. So we bring together stakeholders from the quadruple helix, we support cluster members, and we have cases where cluster members receive services from the European Digital Innovation Hub or the other way around. We have also managed to acquire significant funding for ourselves, meaning the cluster organization, but also for our members. Having said that, I think that I have managed to keep myself under 10 minutes, and thank you for listening to our work at Hellenic Digital Health Cluster. And we have also a panel discussion later on, but I'm always available to discuss anything, so you can send me an email afterwards. So now we will pass to, as Carolina mentioned in the chat, we will not have with us Pascal from Styria Health Tech. He had an emergency, but we work closely and they will support this initiative. We will pass to Diana from iVita. She's the cluster manager of iVita in Lithuania. Diana, it's nice to see you again, since we have this close collaboration, and it's always happy to see you.
Yeah, hi, I will try to share my screen. Okay, do you see my screen?
Yes, Diana.
Yeah, okay, so hi, my name is Diana Vertelkiene. I'm Health Technology iVita Cluster Manager. And today I want to start first from the slide about Lithuania's strategic indicators. So Lithuania has risen the 30th place from 32nd among 67 countries in the global competitiveness ranking in the Swiss International Management Institute, IMD, this year. For the first time since 2020, Lithuania has overtaken Estonia, which dropped to the 33rd place, and Latvia, which ranked 45th. So Lithuania continues to shine as a global innovation leader, securing a spot among the top 35 countries in the Global Innovation Index for the second consecutive year. Despite significant economic and geopolitical challenges, Lithuania has met its national progress plan target of staying with the top 35 countries, ranking 35th this year, a slight dip from last year's record, 34th place among 132 countries. Other achievement is that Lithuania ranks 4th in the Entrepreneurship Index. The country boasts one of the lowest business closure rates among advanced economies, and 1 in 7 individuals intend to start a business within the next 3 years. So Lithuania's leadership extends to high-tech exports as well, with the share of high-tech goods and knowledge-intensive services in its exports increasing from 17.8% in 2021 to 22.2% in 2023. Yeah, very shortly about Lithuanian science ambition in Lithuania. So Lithuania has an really very ambitious goal to accelerate the sector's growth, that it will contribute 5% to the national GDP by 2030. and driven by a remarkable 22% average annual growth rate, positioning it as one of Europe's fastest growing life science sectors. Additionally, with an 87% growth rate in the biotech and pharma sector across the EU, it's evident that Lithuania is making significant progress. And moreover, the sector's vitality is underscored by the fact that 1 in 4 students chooses to enroll in life science study programs. And I think also we have very impressive numbers that 95% of its products are exported primarily to the USA and Germany. I would also like to add that the COVID-19 pandemic made a significant impact on the healthcare industry and allowed health tech to develop more rapidly. So Lithuania was among the countries that adopted new technologies in the healthcare industry to provide the needed medical help for patients during lockdown. And also the life science and digital health sector is high on the political agenda. Therefore, it is boosted by government funding, regulatory support, and innovation-driven policies. Very shortly about our cluster. So based on EU statistics, I think you know that there are currently more than 2,500 industry clusters in Europe, and one of which is the Ivita Health Technology Cluster based in Kaunas, Lithuania. Our story began in 2011 with only 8 members and forming a cluster concept. Today, our growing cluster generates increased revenue, resulting in a turnover of 95 million euros. Our R&D expenditures exceed 5 million euros. Our workforce connects over 2,500 employees, 35 members, and we hold a bronze label. Today, Ivita activity fields covers biotechnology, health tech, and sport technologies, rehabilitation and smart textile, functional food, and other areas within the health and biotechnology sector. So our companies combine different knowledge, therefore we can share strengths, we can change a lot of between each other, and together we can create new products for our healthy future. Very shortly, what are the core services that we provide to our cluster members? So facilitating innovation, fostering networking, promoting international activities, enabling technology transfer, providing educational resources and consulting services. So Lithuania's vibrant health tech ecosystem, featuring both fast-growing local startups and well-known international companies, is becoming the place to develop the most promising health technologies together with prime talent and a number of business accelerators. So innovative startups are the engine of growth and innovation. I think everybody agrees. So within the cluster, our objective is to actively work towards integrating our international network of experts, investors, and entrepreneurs into the Lithuanian ecosystem with the purpose of benefiting startups. And as example, last and this year, we were partners of Health Tech Accelerator, with a 7-week innovation program, attracting different teams consisting of medical personnel, ICT specialists, and other team experts. During this Health Tech Accelerator, last year, we mapped all our existing health tech ecosystem, which connects, as you can see here in the slides, startups, health tech companies, healthcare providers, pharma companies, governmental institutions, associations, universities and colleges, investors and accelerators, ecosystem influencers and enablers like we. With this slide, I want to highlight the core elements that drive Lithuania's dynamic startup ecosystem, especially in the health, tech, and life science fields. So Lithuania is home to over 900 startups with more than 100 focused on health tech and life science. So these startups are driving innovation in areas like artificial intelligence diagnostics, telemedicine, and personalized healthcare solutions, playing a vital role in transforming our healthcare landscape. Government agencies such as the Innovation Agency, Kaunas and Lithuanian Innovation Center, and the Startup Lithuania provide essential funding infrastructure and policy support, helping these startups scale and thrive. Equally important are the venture capitals and clusters like those you see here in blue shapes, which provide funding and mentorship. And in the green shapes, you see the Lithuanian health tech and medtech clusters, offering essential networking opportunities and fostering collaboration. So together, these ecosystem players are driving the growth and success of Lithuanian digital health sector. Lithuanian SMEs and startups face significant challenges to bring their medtech, health tech products to the market and later to maintain high production volumes. And one of the reasons is a long medical devices certification process. And also we don't have a notified body in Lithuania where companies could easily to certificate medical devices and in vitro devices. But now we have a groundbreaking initiative under the wings of the EU for Health program. This initiative called Notified Body Increased Capacity. So together with 11 partners, we have 3 years to achieve project goal to bridge the gap between notified bodies, the medical device industry, market operators, and other players, streamlining the complex process of dossier submissions, reviews, and approvals. Moreover, I'd like to introduce you to the IRHIS project, an initiative aimed at transforming digital health solutions across Europe, with a particular focus on less developed regions. IRHIS stands for Interregional Healthcare Innovation Scaling. It is a collaborative effort designed for accelerate innovation, enhance regional capacities, and foster the widespread adoption of advanced medtech solutions, especially in remote areas. Now, why is IRHIS so important in the area of digital health? So, as you know, digital health technologies are rapidly changing the way healthcare is delivered, from remote patient monitoring to the telemedicine. So this innovation offers the potential to make healthcare more accessible, efficient, and patient-centered. However, the full potential of these technologies is not yet realized, particularly in less developed regions, where barriers such as funding, expertise, and infrastructure often limits access to these solutions. So we hope that IRHIS will address these challenges and ensure that these regions can fully benefit from the digital health revolution. And for the end, what key insights are from Lithuania's experience? So first, Lithuania's success highlights the importance of collaboration between the public and private sectors. Government support combined with innovation from startups and tech companies has driven progress in digital health. Second, the Lithuania government's consistent investment in healthcare digitalization, for example, e-health infrastructure and policy frameworks, has been crucial for creating an environment conducive to innovation and integration. Third, Lithuania's thriving tech sector has played a pivotal role in the rapid development of digital health solutions, with startups and tech hubs contributing cutting-edge technologies like artificial intelligence for healthcare diagnostics. And fourth, Lithuania's digital health progress is built on efficient health data management, with the e-health system enabling seamless access and sharing of patients' records. However, the challenges remain, such as interoperability between systems and ensuring secure data exchange. As we enhance data integration, we can unlock the full potential of artificial intelligence and predictive analytics, driving more personalized care and system-wide efficiency. Fifth, digital health tools in Lithuania are designed with a focus on enhancing patient experience and accessibility, ensuring that solutions are user-friendly and meet the needs of patients, especially in remote areas. And finally, all sides agree that integrating digital solution requires ongoing education and support for healthcare professionals, ensuring that they are trained to effectively use new technologies and tools. I think this is something common between all countries. Of course, if you are interested in digital health, so let's connect. You can find us on website or social media. So thanks. This was very shortly about Lithuania.
Thanks a lot, Diana, not only presenting your work at the cluster, but also giving us a glimpse of the innovation that take place in Lithuania. And for sure, we have to arrange a sort of matchmaking between maybe your members and companies in Lithuania and Greek companies. And I will pass now to see the case in Bulgaria. We have with us Mira Ganova from DHI cluster. Mira, thanks for being here, and the floor is yours. Please unmute.
To unmute, yes. Thank you, George, for the invitation. Thank you, Diana, for the complete and useful information that you gave us. A lot of opportunities are in front of us, and we are cooperating already under the IRIS project. So I see a bright future for us to boost and expand the potential of the digital health industry broader. So let me share the screen and briefly explain you about what we are doing in Bulgaria in terms of digital health and digitalization. So I'm here representing the Digital Health and Innovation Cluster in Bulgaria. We are founded in 2018 or 19, the end of 18 and the beginning of the 19, only by David IT companies, one pharma company, a big one, and two NGOs. We have the strong vision to support innovative companies thrive in the complex digital health landscape, and of course, bring more value to the digital health transformation by gathering a vital expert community to boost the sustainability and efficiency of the healthcare sector. Now, 5 years later, I want to make a disclaimer. Bulgaria is not an early adopter in terms of digital health, but now we are moving very fast, taking in mind the latest exponential things that happen in the digital health sphere, in the healthcare sphere. Now our cluster is representing 54 digital health companies in Bulgaria, and we are working with a lot of international and global partners to boost the efficiency in the healthcare system through digitalization and centralization of health data. So me, myself, I'm a healthcare expert. I'm working more than 12 years in the healthcare industry, but mostly I'm a community-driven person. I want to gather people and to make them work together for a brighter future for the healthcare in Bulgaria and abroad. Everything is about the culture, in my opinion. So we are dealing a lot with the cultural transformation in Bulgaria, making the adoption of digital health more easy. And reducing the resistance in the clinical sphere for this adoption. Of course, the digital health transformation is a disruptive process for everybody, but it's very needed to make more sustainable the healthcare environment for healthcare professionals and moreover for patients, and to make conditions the digital health industry in the face of companies to strive better. So back before we founded our cluster, we started to gather people with like-minded visions, how to support the healthcare environment in Bulgaria. Of course, back then in 2016 and 17, we've already identified the global healthcare challenges that we can classify as three main gaps: the accessibility gap. Half of the world's population cannot obtain essential healthcare services. Diana mentioned the rural areas and the less developed regions. It's the coverage and the equal access for healthcare services. It's a challenge indeed. So one of the biggest one that we should overcome is this. The care delivery gap. Here I'm going to focus the quality of the medical care, not only the delivery of the medical care. So if we overcome the accessibility, is it enough quality of the medical care that we delivered? And of course, the information gap, it was already mentioned about the interoperability and the connectivity between the healthcare systems in Bulgaria, but abroad is a global challenge. In terms of Bulgaria, to be honest, it's quite pity that we are ranking very negative statistic in Europe. So in terms of population, we have aging population, and it's increasing the latest year. We are one of the countries that marks high ranking in terms of mortality from chronic diseases, particularly cardiovascular diseases. So I'm very happy that we will have the chance to create an integrated care model for cardiovascular patients under the IRIS project that we are working with George and Diana. And of course, again, the paperless healthcare, it was one of our priorities for Bulgaria to digitalize all the historical information and the current information at one place, and centralize the health data to decrease the burden, the administrative burden from the healthcare system and the healthcare professionals. So the solution for us back then was only one, and this was digitalization and full digitalization process for the Bulgarian healthcare system. Why? Because we can make equal access, faster and easier access in Bulgaria for healthcare services. Of course, as Diana and I mentioned, rural areas, how to cover them how to deliver better and quality healthcare services there, and how to capture and centralize data so to be able to make population health management reports and know how to direct better the state resources in terms of human and financial resources around and in our country. I already mentioned that centralizing the data and research over the data, the primary and the secondary use of these data can improve significantly the quality of the medical service in terms of screening, predictions, treatments, rehabilitation process, and cover the whole patient journey with a quality data and predictive models. And for sure, the digitalization of the healthcare is bringing positive healthcare outcomes for every country and for every single patient. So centralizing the data is bringing and making more transparent the process to organize effective decision-making for the population in any country, improve the control, the predictability, and of course the overall efficiency of every healthcare system, generating better and improved healthcare outcomes for the country. And that's how we decided that Bulgaria needs an organization that could facilitate the whole digitalization process within the country. But how we decided to do this, it was like very strategic approach back then in the late 2017 when we started thinking and developing the project. So we decided to organize organization that could orchestrate the whole process and create a vital platform where all the stakeholders could collaborate, exchange expertise, and communicate easily. So global collaboration was an aim from the beginning. The very big focus for data centralization and a lot of tools and AI features to analyze the data and organize better healthcare models through this analyzed data. Innovative funding models was the other purpose of our organization, how to bring more funding and more valuable project for the healthcare industry in Bulgaria to support the developing of their already existing potential, but also to support them in expanding this potential internationally. Of course, a strong focus in public-private partnership was a goal as well, because we wanted and want to support the state in their efforts to create a better healthcare environment, an efficient and effective one for all the stakeholders. So this is the DHI cluster as a platform for effective collaboration between the state, between the healthcare industry in Bulgaria, between researchers. We made everything with a strong vision how we should organize a vital digital health ecosystem, and we called it National Digital Health Architecture. So our strong focus was to put the patient with his needs and his data in the center of the system, and facilitate all the stakeholders to collaborate effectively in our platform. So as you all know, the digitalization and the integration of digital tools within the whole business environments and processes of any industry brings us a lot of value in terms of centralized data. Decentralized data could bring data intelligence and information maturity for the whole society, which is a very important when we are speaking about less developed regions. As I mentioned in the beginning, it's a matter of culture, it's a matter of mindset and information maturity. So creating a process where we can centralize the whole health data in one place will for sure bring us this information maturity, and this will allow us to produce experts on educational level. So to expand this potential and this knowledge and bring this valuable and useful knowledge in the universities, within the universities, and produce experts at university level, not educate them after they're graduated from the university. Of course, this is some kind of circular economy, the principle of the circular economy that we invented back then when we started creating our digital health ecosystem. And we created very strong community model. So the community model is a creation of multi-stakeholder community, a group of people which can connect and working together as a community with a very strong common goal. So as we are a very niche and domain expert organization, it's very important for us, all our members, to be partners, to know themselves, to know very well their own solutions, to can organize together partnerships in terms of joint products, joint solutions, and executing joint projects. This brings a lot of value to every single SME, every company that can gather and receive more expertise from other partners and use it as his own in terms of developing and executing projects. So our strong vision when we started fostering the digital health ecosystem in Bulgaria and creating this vital community was very precise, to gather all the main stakeholders in one place and foster them to work together, to exchange knowledge, to exchange expertise, and to know them, to know themselves better. So we are supporting the development of healthcare solutions. We can connect key partners and key stakeholders in the digital health and the healthcare sphere. We educate for digital health and innovation to build a culture of collaboration, which is a very important thing in matter of mindset. And of course, we communicate very proactively with the society and within our community with the purpose to change our healthcare environment, of course, positively, and foster the digital health transformation in Bulgaria and expand and develop the potential of the digital health industry in Bulgaria abroad. We are working very strictly in 3 domain strategic pillars. The first one, I explained it very well, is the community. We are working as a vital business platform for collaboration between our members and the other stakeholders in Bulgaria, state, academia, research industry, pharma industry, personalized medicine, and all the other stakeholders. Within this very strong pillar, we are organizing at least 2 events per month for our members. We have several types of events. We have community grow events. All our new members are representing their solutions in front of all our community. We have knowledge building series. We are inviting very interesting and valuable experts to engage our community with high valuable topics. For example, we are organizing seminars and community and talks for UK opportunities, how they can expand in other markets, for pitching elevation, for regulation in terms of MDR or European health data space, how to be better compliant to all the European regulations that are followed, and we should be aware with them. We are working very strictly in other pillar, which is the policy one. We are supporting the state in every digital health or healthcare initiatives in terms of regulation. Lately in Bulgaria was accepted the telemedicine regulation as a law under the Healthcare Act in Bulgaria. So I may say that we, as an organization, we were the main driver to develop all the content within this regulation and foster the adoption of this regulation with the parliament. So we are very happy that we are going to have regulated telemedicine activities in Bulgaria. And the other pillar that we are stepping very strong there, it's the academia one. We are working with the whole academia in Bulgaria, mostly with the medical universities in Bulgaria. We are developing a lot of research projects with our universities. So a lot of AI projects between the academia and the researchers there and our companies. We have a mapping of all our expertise of our companies, so we can make the matchmaking between the research activities within the university and our precise expertise in terms of technologies very quickly. So we have over more than 30 projects between our SMEs and the academia in Bulgaria. We also are partnering with the other research institutes and academia internationally. Lately, we are participating in a very big work group for the Nordic region with all the universities, university hospitals, universities, and research centers there for capturing the health data, taking in mind the complexity of the healthcare sector as the most complex socioeconomic one. We are building a very strong and expert community for data analytics and secondary use of health data. So we developed as well an architecture for secondary use of health data, fully compliant with the European health data space. And we are developing this pillar very actively with the researchers from the medical universities. Also, we are engaging with the social
Mira,
activities.
sorry to interrupt. I'm afraid that we will run out of time. So please
Yes, I'm
speed
going
it
to
up.
be
Yeah.
very quick. Of course, this is my latest slides. In all of these, there is a very big opportunity for SMEs to strive to expand, taking in mind the exponential growth of the the healthcare market itself and the digital healthcare market as well. We are seeing a lot of business opportunities for developing the potential of our SMEs together with other clusters and with other partners. Here you can see our members. As I mentioned, we have more than 50 members in our community, a lot of partners and a lot of honorary members. We are working closely with the medical sector in Bulgaria, so we attracted a lot of healthcare professionals to work with, because it's very important when you want to deliver something valuable to be developed together with the clinical sphere. So to be precise and to be at time and to resolve concrete healthcare needs. This is our mapping of our members and of the digital health industry in Bulgaria. This industry can cover the whole value chain in the healthcare, in the digital health as well. So as a community, we can develop end-to-end projects from well-being and prevention through diagnosis, treatment, to recovery and rehabilitation. A lot of use cases and a lot of companies that strive for better healthcare, and they're here to support the digital health transformation in Bulgaria and to partner with other intermediate organizations, George, like IVITA and Hellenic Digital Health Cluster. So thank you very much for your attention. You can follow us on LinkedIn. We have very well developed page there, so we'll be very happy to exchange information in LinkedIn. Thank you.
Thanks a lot, Mira. And I didn't want to interrupt because I really enjoyed your presentation. And I like the fact that you mentioned many times the end goal, that is the end user. You said many times that we have the goal is to improve patient outcome. So
Yes.
we are doing that through supporting companies and organizations that are working on it. And this element is crucial because, as we are saying, that we do support companies, organizations, but the end goal of advancing digital health solutions is that you improve patient outcomes, and that's really important. And I saw that you mentioned it many times in your presentation. Now, just a couple of minutes, we're ending this event. I would like, let's say, to ask about a wish that you have. For example, what would be the way forward for your clusters or your ecosystems that we set aside the barriers that we all have in our own ecosystem? What would be the wish for you, for your organization, to make your work better and better support companies? Diana?
Yeah, so talking about Lithuania and our cluster, so I see that we could help really in driving adoption of artificial intelligence and big data in healthcare, because we are really communicating a lot of with SMEs, innovators, also together with healthcare providers as hospitals, clinics. So here we can help a lot to achieve good results in interoperability, connecting health data and to help integrate various systems, and especially new innovations when we are talking about, for example, wearable devices which are new, using new technologies. So in Lithuania, we have a very conservative system, and sometimes for innovation, it's very hard to how to say, to get access to those hospitals or clinics. And yeah, also one more challenge always is regulatory and ethical frameworks. As I'm already mentioned that Lithuania don't have a notified body, so here we see a very good way where we could also help for our startups, SMEs, and other stakeholders to help them faster to get access to the market. So maybe I will stop on those 2 points.
Okay.
Maybe Mira could.
Thanks, Diana. Yeah, Mira, the way that you see forward, even I was asking, even at the operational level of the cluster, apart from the general industry of digital health, what would you see as a way forward, Mira?
We have the same barriers like Diana mentioned, so we should overcome them together in terms of European healthcare systems. But to overcome the access and the adoption of digital health solutions within the medical sphere, because if we want to improve the healthcare outcomes. So we should work with healthcare professionals, and we should work, as Diana mentioned, with hospitals, with clinics, with inpatient, with outpatient care, to make them work better and take informed decision making. Taking in mind the exponential growth of the medical information all over us, of course, there is no chance any physicians to work without digital health solutions. But there is a lot of resistance within the medical sphere. So activities in terms of capacity building within healthcare professionals, educational activities, and activities that can support the reduction of the resistance for the healthcare professionals to work and adopt digital health solutions is very needed in Bulgaria, and I think that in your countries as well. Of course, support to SMEs for better and faster market access of their solutions is other way that we could collaborate on. Because it is you both and our audience know that the digital health solutions, they are only a tool to achieve something, to overcome something, and to resolve a concrete problem or a concrete need. So we should think how to organize a better modeling and strategizing healthcare systems, not only in terms of health tech and technological improvements and technological boosting somehow, but in terms of integrated care models, not just to implement a technology like project or like a partial thing, but how to connect this technology in the whole healthcare landscape and value chain, and how it's connecting with the patient journey, with the patient experience, with the patient outcomes. So it's very important all our clusters to collaborate in terms of a holistic healthcare approach for integrating digital health solutions within the healthcare landscape, and how we can be a better strategic communities to support the state taking better decisions in terms of healthcare outcomes.
Great. Thanks, both of you, for mentioning the barriers and ways forward. I think that we have to collaborate even closer. We collaborate now under the ARCHID project, and it's good to see that we have members of all of our clusters collaborating and developing solutions and investing in the regional projects. It's something significant, because we give these companies the opportunity that otherwise may not have to collaborate with a service provider, with other organizations in different regions, and in that way further developing the solutions and building their own capacity. So having said that, I think that we can end here. This event will be also posted in YouTube, and will communicate it also through the ACH Alliance networks and channels. Carolina, thanks a lot for having us. I think that the presentations were a source of thought for our work as cluster managers and as people facilitating the networks. And we will be happy to connect again in any occasion. So I don't know, Carolina, maybe you want to have the final word here.
Thank you so much. Thank you, George. Thank you, Diana and Mira, for your presentation and contribution. And thank you all for joining us for this webinar. As I said, this is organized by the ACH Alliance, the Global Health Connector, and the Hellenic Digital Health Cluster within the framework of the Digital Health Uptake Project. The Digital Health Uptake Project is ending now at the end of October. This means that, of course, lots of different results will be released So follow the digital health uptake as well as our organizations on LinkedIn to get access to those results and to also benefit from those results. One of them is, for example, the innovation radar, where you can submit the information about your solution and make it more visible to the regional and the national governments looking for this kind of solutions. Thank you all for participation, and I wish you a lovely day.
Okay, thank you.
Thank you.
Thank you.
Bye.
Thank you very
Bye.
much. Bye bye.